Good afternoon or good morning, wherever you're tuning in from. Have another episode of Foundations and Wellness podcast today with your host, Teresa Greco, nurse practitioner and functional medicine provider, and a whole host of things. It's really awesome. We're here dedicated to help women, especially those in the peak of their careers, age 50 to 60, helping them find holistic health solutions to their health challenges. So today we're going to be diving into a topic that is often overlooked, but it can be significant to your health challenges and that how it can impact you, and that is parasites. What we want to uncover and help you better understand is how parasites and their effects is crucial for anyone dealing with autoimmune conditions, chronic fatigue, brain fog, and etc. So let's get started. So Teresa, I just want you to talk about kind of the definition of what parasites are, why they're so overlooked, and why you don't have to travel out of the United States to get a parasite.
Yeah, well, the first time I had a practitioner tell me, he thought I had parasites, I was like, that's gross. You're like, because I'm thinking, I have traveled outside the country. The first trip I ever went on was India. And so I could see where there would be parasites, in that environment. And the second big mission trip that I took was to Guatemala, and I actually did get a parasite. I was like, we took bottled water and, but I inadvertently stuck my toothbrush underneath the running water in the bathroom one morning and stuck it in my mouth. And as soon as I did it, I was like, uh-oh. Sure enough, a couple weeks later, I got home and I'm like, oh my gosh, I have amoebic dysentery. So that in my mind, I was like, well, that's the only place you could get parasites, right? Is traveling outside the country. And then, when this practitioner that I was going to a long time ago, he's like, no, that, you can have parasites even in this, even in this country, that's a possibility. I was like, okay. So it took me a minute to it took me actually a little bit more than a minute to really accept the fact that yes, I probably did have parasites. And, what could I do about it? So parasites are just anything that lives in or on a host organism. They thrive and get their nutrition and all the things that they need to live and grow from the host. So parasites can come in a lot of different forms. We can have tiny, tiny little ones, like single-celled ones, the kind that I got are called protozoa. And then they can come in forms like worms, different kinds of worms. There's flat worms, there's round worms. Those are called helminths. And if you want to get real specific, they're cestodes, trematodes, that kind of thing. Or they can be flukes, which are they kind of look like flat eyeballs. And they can live, in different places in your body. And then we have the parasites that live on us mostly. Things like ticks, lice, even mosquitoes, things that live off of you. Like a mosquito comes, it bites you. So you don't think about that when you're getting a mosquito bite. We don't think of them as being a parasite, but that's why they come and bite us or, do what they do, is so that they get something from us so that they can live. And when they do that, so when parasites come and they live on or inside the host, they are getting something from us, but oftentimes they give something to us. And so the consequences of having a parasite is multifaceted, which is what we're going to talk about today. But the other thing, that my doctor friend told me, he's like, well, you think about it. You go to the vet and you get a prescription to give your cat and your dog to deworm them, to prevent them from getting ticks, fleas, worms, whatever. Those are parasites. So if you, by nature, if you have a dog or, cat, a pet, you just, by taking care of them, get exposed. Easy peasy. You don't even have, and when he said that, I was like, oh, yeah. Okay, that makes sense. I had a cat and a dog. I clean up after both of them. My dog licks my face. I don't like her to lick my face, but she does. And she's taking care of herself. So where her tongue has been, it now, can get transferred onto me. So I was like, oh, okay. And then he's like, oh, have you ever eaten sushi? And I'm like, yep, sure have. He goes, okay. And he showed me this YouTube video of a person taking a piece of sushi, raw fish sushi, cutting a little sliver off of it, sticking it under a microscope, And I was like, and it showed like living worms. And I was like, okay. Well, I will never eat sushi again. I can never look at sushi in the same way.
My
And
wife are
then
the same.
the obvious, water. Like, and so those are the ways that we get exposed in our country. The three big ones is food, undercooked or raw food, water that's not been filtered or contaminated, like drinking. I had I had a friend who drank water from the Nile and ended up with not just a parasite, but hepatitis. But it happens in this country, unwashed food can happen all the time. People get things like that. And then in our pets. So those are the kinds of parasites, and that's how we can get exposed. And then, like if we're not washing our hands after we clean up after the animals, if I go outside and I clean up the yard and then I go and do other things and I don't wash my hands afterwards, sometimes, that's another, the way that can happen. And then sometimes, like the ones that live on us, like ticks, it's just like living in an area where they're endemic, where there's a bigger population of them. I live in the northeast in Pennsylvania, and I mean, like we have ticks everywhere. And Lyme disease, is one of the things that is a result of that. It's really prevalent in the Northeast, because we have, such a high population of ticks, and we just haven't been able to see that come under control. So if you go for a hike, which we used to, I mean, I had, even in my yard, I used to have quite a bit of land, and my dog would go out, play in the yard, do his thing, and come back in. And I would pull no less than 9 ticks off of him every day, just from being in the taller grass that we didn't mow down in the fields. And then I think, okay, well, I was out there gardening and my kids were out there playing on the play set and stuff. So of course, we've gotten bit by ticks. And of course we have the potential to have exposure to the things that they carry and transmit to us. So that's
Really
that's
great.
yeah, that's a
Yeah.
like the basic information.
Well, I want to share because, when my wife was pregnant, we had a cat, and the doctors always tell the pregnant woman to don't change the cat litter when you're
Yeah,
pregnant. I don't
yeah.
understand why, but there's a parasite called Toxoplasma gondii,
Toxic. Yep.
and that's actually screened for on the Vibrant Wellness 2.0 tick-borne panel.
Yeah.
And I had 2 personal clients that I worked with, and both females had that parasite. Excuse me, with them. They didn't have miscarriages or
Yeah.
anything to do with their pregnancy. I do find it interesting that one of the women had her 12-year-old now has
Yeah.
pandas, one of the two.
Yeah. Yeah.
But really interesting. And you were mentioning too about living in an endemic region in the Northeast, and you're not exempt if you live somewhere else, because
No.
I'm in Texas, and down here we have what's called the Lone Star tick, and you can get Rocky Mountain spotted fever, which is a
Yeah.
bacterial infection, but you can also get ehrlichiosis, which is another bacterial illness
Yeah.
due to this tick bite.
Yeah.
Uh, you can get what's called stari, which is a southern tick associated rash illness, and it's a circular rash similar to what's found early sometimes in those with Lyme disease from Borrelia, which is that bullseye rash.
Hmm.
And that can cause fatigue, headache, fever, muscle pains, so closely related. I mean, it's in the Lyme disease family,
Yeah.
but different tick. And that's the thing, is that there's so many different
Mm.
nasty stuff that ticks can carry and transmit to us. And think of Babesia. That's a red blood cell protozoa parasite that feeds off of our red blood cells and breaks them down. What else did you say? Oh, another great um, cautionary practice is, why do we wash our fruits and vegetables? My wife is always on me for this, because when we go to the store, if you're not growing your own food in your backyard, which I don't, I got a small herb garden, but that's about it. I go to the store for most of my other stuff, and that could be Whole Foods, Sprouts, or natural grocers. But think of all the people. Well, first think of where that food is coming from,
Yeah.
where it's grown. It may be organic, but where's it coming from? How's it transported? What do they treat it with? What do they spray it with? Because they still do. They might not use toxic things like glyphosate, but they still use organic or less harmful products. And then being at the store, what if a person picks their nose or scratches their private area, and then they touch a bunch of cilantro or whatever? I
Right.
dropped a bunch of cilantro on the floor, and I was like, oh, shoot. And my wife goes, pick it up, just put it back. And that's why we wash our vegetables and fruits at home.
Yeah.
And I was like, oh man, because there's so many times I'll be at the store at Whole Foods and I'll open up a berry container and I'll try it to see if like the berries are sweet or if they're too tart or if they're ripe or overripe. And how many other people do that? And
Hmm.
we wonder why this nation struggles with so many gut issues, right? And
Yeah.
back when I was a kid, it was like, don't drink the water when you go to Mexico. When my parents would come back and be like, oh man, I drank the water and I got sick for 3 days or whatever. And I mean, yeah, those are telltale signs, obviously, that you're probably going to have a parasite. Another way that this is kind of off topic, but a big reason why people get SIBO or gut issues is from food poisoning,
Hmm.
um, which is a bacterial illness. And, you can start to change the environment down in your gut to where when you have an overgrowth of a bad population of organisms, they can invite other unfriendly, unwanted organisms such as parasites. And so it's
Yeah.
a real convoluted mess.
Yeah. Or other way around. So parasites, because they are living off of you, especially the kind that live inside of you,
Mhm.
because they, by nature, they draw something from you. So they draw nutrition from you. They draw vitamins and nutrients and take away the things that you need to thrive. And they deplete the immune system and excuse me, and they do, they take from the host what they need. Then just like the SIBO can set us up for, parasites, it's the other way around. A lot of times it's that is what comes first is the
Right.
parasites because we're not aware, like that's the thing. That's the whole part of the lead-in discussion about parasites. Most of the time, we just don't even have an awareness. So just
Hmm.
by listening to this podcast where we're talking about parasites, now you're raising your awareness. Now
Right.
you know there's something to do. Is it gross? Like I said, is it gross? Okay, there is something in our, like, we think in the United States because we are so much better off, have a better living environment than people who, live in cardboard boxes somewhere, or don't have enough food or whatever. We think that we're exempt and that these things don't touch us. And that's just not the truth. So now that you have the awareness, now you are empowered to do something about it. That's the whole point of us actually doing all the podcasts and all the things that we talk about is giving you something, raising your awareness. So now you know something that you didn't know, and we're giving you information about, how to prevent it and what to do, how to know that you have that thing going on, and then what to do about it if you think that you're suspecting that maybe that's the issue. So, I just kind of wanted to throw that in there because I feel like sometimes our perception is what it is because we just aren't aware, and it is
Hmm.
a pretty common thing. And it does set us up for other things happening. So just having in the awareness a lot of times can then pique our attention so that we pay more we pay more attention to the things we're doing, like washing your hands after you take care
Simple
of your
things.
dog, or watching the cilantro, before, because who knows if the guy before you picked it up, dropped it on the floor in the grocery store, and now you're taking it home, and now you know you have tainted cilantro.
And some that are disgusting. Maybe they were scratching their private area or their butt, and you don't want those nasty things on your food. Just saying.
Yeah. Yeah. No, it's so true. I mean, there's it's a certain thing about, there is an element of being too focused on the hygiene kind of thing. So where you're like so super focused that you're paralyzed in fear, or
Right.
there's just being aware, doing what you got to do, wipe off like I oftentimes will wipe especially during the winter months, I'll wipe off the shopping cart handle, just because you don't know what somebody's done, and I'll just and I don't even think about it. It's not because I'm afraid I'm going to get sick, but I'm just like, you know what? I brush my teeth every day because I don't carry. So why would I not, and I wash my hands after I go to the bathroom. So why wouldn't I do this in a
I
public
must
area?
confess, because since the pandemic, this is perspective. I look at people as hyper germaphobes when they're washing out their baskets because I never do that. I'm like, oh, come on. Why you got to be so cautious with wiping everything down and pumping sanitizers in your hand every 20 seconds?
I
But
don't
no,
do that. That's too much. That's actually not a good thing.
right, because you're sterilizing yourself and you're inviting
You're
bad bacteria.
removing the good, you have microbes on your hands that are beneficial. They're meant to be there for a reason. So that's too far, but I will wipe I don't wash, like I don't, I'm not hyper vigilant about washing my hands. I don't, absolutely, why would I put alcohol in my hands if I didn't need
Right.
to? You know, when I worked in the hospital, that was different. In the
Right.
ICU, I would wash my hands and I would use the sanitizer because I was going into a very um, germ thriving environment. But at home, I did, you know, I never did that. But I will, you know, and not all the time, just in the winter usually. When I see other people like coughing and stuff, and I'm like, oh, okay, well, I'm just gonna wipe this off, just and I'm gonna go my way. So
Absolutely. And
yeah,
talking about parasites and autoimmune conditions, they affect the body in different ways by weakening our immune system, and they can ramp up the inflammatory process. And so I think of women who suffer with Hashimoto's, maybe they have it under control, maybe they don't. Oftentimes I'll find a parasite known as blastocystis hominis, which oftentimes is correlative with a woman's thyroid numbers and their autoimmune attack with Hashimoto's. And a thing about the blastocystis hominis parasite is that it can cause enough inflammation and increase the leakiness of your small intestine. So you talked about earlier on how a parasite is a host that basically, or I'm sorry, it's an organism that attaches itself to us, the host, and it draws from us. And so it depletes us. And you were mentioning about, parasites can drain the body's resources of, uh, think of iron being anemic, or vitamin B12 or other nutrients, magnesium. And so you could be eating that perfect diet and still be wondering, why am I doing all the right things,
right.
but I'm not feeling like I'm supposed to? How come
Yeah,
I'm not gathering the information from this food and going into my body and feeling the benefits of that?
yeah,
Well, that's when you might want to investigate, okay, how
yeah,
really good is my gut health? And is there a hindrance? And do I suffer from an autoimmune condition? Because if you do, then it's a very good chance that you might have a parasitic invasion of some sorts.
yeah, yeah. And the
Would you start?
and the point you made about the, you know, the leaky gut, or the, you know, the fancy name is the intestinal permeability, you know, yeah, that that can come from a lot of different things,
Right.
including eating glyphosate, pesticides, you know, things like that, certain foods that you know, are more processed and stuff like that. Parasites for sure can do that too. So an
Hmm.
autoimmune is when our immune system this has kind of decided that we are a foreign invader. Our body is, there's something about it that it doesn't like, and it starts to attack itself. That that and leaky gut go hand in hand 100% all the time. That doesn't happen if our gut is perfect, because we are in an optimal um, GI tract has this beautiful mucosal lining that protects us. It's a barrier from all the bad stuff. And we have lots of good bacteria that do all the things to kind of keep the other stuff at bay. But
Hmm.
when there's damage, you know, and then the villi, you know, like are working just the way they need to, and we absorb all the nutrients and we get everything beautiful out of our food. But if there's gut damage and intestinal permeability from all kinds of things, including parasites, then that absolutely can lead to autoimmune. And parasites for sure can be a cause of that.
Absolutely. So what are some common symptoms that one would experience? Because I'm sure they can vary, but I mean, what are some common ones
Yeah.
that you've seen patterns of? And
Yes, it's so when you're thinking, we just got done talking about gut. So think gut symptoms, that's a big one. You know, gas, bloating, constipation, diarrhea. For
how many people
me,
suffer with that?
all the time, right? And I had somebody, one of my clients sent a question and thought maybe it was that he was having these issues and it was the probiotic. And I'm like, don't blame the good guy. You know, like it's probably something else. Let's talk about this, and this, you know.
Mm.
But all the time, gas and bloating, diarrhea, constipation. For me, it was the diarrhea. When I had the amoebic dysentery, that's what I had. I had a lot of abdominal pain and bloating for sure. But well, okay, and so think about that. So if we have unexplained weight changes, particularly weight loss, if we're not getting the nutrition that we need, we're basically, and this is actually more prevalent than most people have an awareness of in this country. Again, we're talking especially in this country, malnutrition is a thing, even among people who have everything that they need and never lack, you know, for food. They don't, you know, there's not a food shortage kind of thing. And
Right.
they eat good quality food, even stuff like that. If you have parasites that are drawing all your nutrition away from your body, then weight loss is a big thing, big thing. Sometimes weight gain because it can cause shift in hormones sometimes, but usually it's weight loss. You could have just joint pain, because some parasites live in little pockets and pocketed areas. So joint pain, joint stiffness, muscle aches, fatigue, brain fog, those can all be things. I know this sounds gross, but some parasites can cross over into the blood-brain barrier and live inside the brain, can cause all kinds of issues there. And then, when there's damage to the gut or when things are living on or in us, we can have skin manifestation. So rashes, like you mentioned, the bullseye, dry skin, eczema. So that's itchiness, sores that won't heal, things like that. So it can manifest. I mean, if you think about, yes, all that. So if you think about all that list of things, like that could be a lot of other things too. So we often don't blame what we have going on parasites, again, because we're not aware, but also we think, oh, maybe it's, I'm trying to think off the top of my head. Maybe it's just our diet's not great, or, we've got some other kind of thing going, or it's allergies or whatever. But, it's that maybe we had bad Mexican, food or whatever. But if we think about it, especially if the symptoms are chronic, like if these things have been going on for a long time and you can't figure out what's going on, and the regular doctor would say, oh, take a Gas X for the gas and bloating, or take a Pepcid for the heartburn or whatever, or put this steroid cream on that rash. They're treating the symptoms, but they're not going, okay, why is that happening? What's the cause of it? And maybe we should, kind of think outside of the box. And that's where a lot of it, like the initial, when I have a patient come in to me right away for the first time, I do a big extensive blood panel, and I do a test that will detect a lot of the stuff. And when people see parasites, they're like, what?
Yep.
Yep.
A lot of factors that influence the susceptibility, because a lot of times too that people can still have these underlying issues, and they be missed on test because the avoid host defense, our immune system, and the size of the parasite, large and mobile, and the ability of these worms to move actively through tissues, and the longevity of the parasite, there's autoinfection, so meaning that you have a full life cycle, such as certain critters known as strongyloides, trichinella, and tapeworms, because they're feeding off of us and they don't want to die, and they're resistant to treatments oftentimes. And a person usually doesn't just have one thing going on, they got multiple. And so it's hard to figure out, is it the parasites, is it Lyme, is it mold, or what's the cause here? Well, we know that the immune system is out of balance. So first, how can we reduce inflammation by identifying its source and removing it as much as possible? And it goes back to the things that you and I always talk about. We clean up our diet, we really try to clean up our environment, and then we begin to continue to hone in each step of the way. And that's where we really help a lot of people at Foundations of Wellness, is by taking a bio-individualized approach in that area. And, you've already mentioned some things like hygiene, food, diet, the correlation between the level of infection and number of infective stages encountered, because they do have certain life cycles that they go through, and the efficiency of our defense system, of our immune system. And so you were talking about pets, and, most people have their pets that are indoor, outdoor, or some people just have their pets that live strictly indoor. You really need to pay attention to your health, and you probably need to take more cautious precautionary measures because you have pets, especially if they sleep with you. I've heard stories from other podcasts about where a woman who sleeps with her dog, and she couldn't kick candida, and she was wondering why, and the dog was carrying the candida on its skin, and the lady was basically just becoming reinfected from herself. And so, there's so many things, and there's stool tests, the blood tests that you mentioned. You can even do imaging like ultrasounds and x-rays or CT scans to identify larger parasites. But from a functional medicine perspective, looking at how we, emphasize that comprehensive health assessment, we're looking at detailed client history of their health. We want to track symptoms and correlate that with the potential exposures. Recently, I had a person who was a dog trainer, and so she's always around dogs, and she had Hashimoto's and she had Lyme. She was living in mold. We knew about these things, and so it was helped us to be more um, intentional about what we were treating and why. And it wasn't until we started tackling the parasites that she was becoming to experience breakthroughs in her health, and it was taking the burden off her immune system to deal with the mold better, to deal with the Lyme better. And she was like, "Oh my gosh, I'm, going to poop and there's like stuff that I've never seen before in my stool in the toilet, and
Yeah.
I'm doing coffee enemas and I'm flushing liver flukes." And
Yeah.
she's like, "I never known that. I would have never known to do this." She's
Yeah.
like, "I'm telling my friends because they need to do this too, who I'm in the
Yeah.
circles of dog trainers with." And I'm
Yeah.
just like, for real,
Yeah.
you know?
Yeah. It's always interesting. So, I was trained first as a conventional family nurse practitioner. So, we were taught, and even when I worked in the ICU or the ER, we were taught, oh, just do a stool, an ova and parasites. It's called an OMP. And, you know,
Or can I
like,
ask you a question real quick about your traditional training?
yeah, sure.
Because, and this is a question for my mother-in-law,
Yeah.
because I did a stool test on my wife called a GI map and a gut zoomer, and they're two
Hmm.
different really good functional labs. And I picked up Giardia on my wife, and I picked up some other autoimmune triggering bacteria and some infections in her, and she had some antibodies to Hashimoto's and whatnot. And this was about 5 years ago. And I was trying to explain to my mother-in-law, I was like, "I know you have parasites because you sleep with your dog and it sleeps on your bed. And I just
Yeah.
know that you do."
Yeah.
There's I heard a doctor once say, "Here's how you can tell if you have a parasite." And he puts his two fingers to his carotid artery and he goes, "Yep, if you got a pulse, you got a parasite." And it's so
Right.
true. And
Yeah.
so, based on your traditional training, because this is what I was wanting to ask you,
Yeah.
my mother-in-law was like, "Well, I'll just go to the doctor and I'll have them run a parasite test." And so she does.
Yeah.
Nothing was picked up.
Right. That's what it. I was just going to say. So when you collect the sample, and it's sort of like when you do the gut zoomer, when you do the GI effects, it's a stool sample. So,
Mhm.
it's a very small sample. So all they do in a traditional chest test is they will just do a visual view of the sample under the microscope, but they only take a little piece of that. So unless you have a profound amount of parasites, that oftentimes you don't see them. I mean, think about it. It's a tablespoon, and then they take a piece of the tablespoon and look at that. So oftentimes you don't see the parasites under the microscope on a test like that. Even in like the more functional tests, like you mentioned, like the CSAP, which is the comprehensive stool analysis and parasitology, or the GI effects, which looks at that plus other things. You often don't in the visual look at the stool, you don't often see that. What I like about the other tests is that there are certain chemicals that the parasites will emit that will be elevated. So if those things show up, then you know that you have a parasite. For
Mhm.
instance, when I first did my first functional stool test, oh my gosh, like I don't know, years ago, it said that I didn't have yeast, but I had yeast symptoms. I had candida symptoms. I had like athlete's foot that wouldn't heal, and I would get recurrent yeast infections and things like that, vaginal yeast infections. And I'm like, I know I have yeast. Like this is something I've been chasing for a really long time. I know I do. How is this not? And so when I was looking at the way the test report comes out, the visual breakdown, the visual scan is the first page. So it said no yeast present. I was like, that's not possible. Then I turn the pages, and then I get back to the page where it says, I forget what the name of the thing is that it emits, that there's a name, a specific chemical that the yeast, it happens when the yeast breaks down. And that
Mhm.
was like through the roof high. And I was like, bam, I knew it. I have yeast. We couldn't see it on the sample, but it showed up because those chemicals wouldn't be there. And then the test that I run is a bioenergetic. So everything has an energetic signature, and everything, it has like a blueprint. It's like the thumbprint for that thing. So it's what makes that what it is. And so the test will look for that fingerprint in the sample and send it back. And if the fingerprint is there, then, you know, that's what you have. So sometimes when I do the traditional tests, even, you know, like the ones that I trust, sometimes they don't come out real high level, but it'll show up in the energetic test. And then I'm like, okay, this is what we're going to do. Most of the time it will show, if it shows up in the bioscan, it will show up on the other tests, just because the energetic test is it's so accurate. I literally had, I did the really like the gold standard Lyme test on a patient this week. Or I reviewed it with him this week, and it was like the big, because I knew that was what was going on. And I had done my scan, my energetic test, and they both showed the same thing. So I knew it was accurate. And, so, you know, I will, and sometimes even without running a test, I will just preemptively treat for parasites, because I'm pretty sure that that's what's happening. That's what's going on. And you'd be surprised at what happens when you do that. And treatment, so we can just talk about, we'll just talk about treatment real quick. So treatment can be in a bunch of different forms. So because I have a license and I have the ability to prescribe, if I were in a Western setting, that's how we were taught to treat, is with prescription medications. So I have the ability to do that. So I oftentimes will do that. And for protozoa, it works a little bit differently. They don't have the same kind of life cycle, but I often, to get to your point to what you said about the cycling and how they grow and the stages, I will pulse the treatment. So I might do 3 days, because I'm going to treat what's alive. And then I'll wait and have them come back and do another cycle of 3 days, 2 weeks later, because specifically for worms, the different kinds of helminths, the worms, the live ones is what gets killed during the first stage, but then they have encapsulated babies. And if I kill the live one, it opens up the capsule. It's like a survival mechanism. It opens up the capsule, and now I've released 5 babies for the live one that I just killed. So I come back around the second time and I treat it, you know, in the back end, so that we get the you know, both of them. If I'm doing there, but if it's someone that doesn't have the ability to prescribe prescriptions, and oftentimes I have folks that say, you know, I don't want to take a prescription. Can we just do like a herbal? And I'm like, sure, that's absolutely. The prescriptions have a very, very, like, the safety profile, like there's no drug interactions. They don't interact with anything. And there's minimal, if any, side effects. Nobody, you know, like hardly ever gets, you know, if anything, it's a little bit of nausea, maybe GI belly stuff. But there's lots of really good herbs that work. The ones that come to mind are black walnut, mimosa pudica, garlic, sweet wormwood, clove oil, berberine can work for some,
Oregano oil,
olive leaf extract. Yep.
seed extract.
Yep. Grapefruit seed extract. Yep. And grapefruit, and some of those are also, they work really well for yeast too. Because I feel like yeast is just as much of a parasite, even though it's not classified that way, just because of the way it lives and it seeks to survive.
Right. It's opportunistic.
It's very opportunistic. It'll actually make you crave sugar because that's what it needs to survive. Right. So, and so, like, one of the things I do when in conjunction, we talked about diet a little bit, we addressed it a little bit earlier, but, like, if I'm treating anybody with autoimmune, they're automatically going to get put on a certain kind of, lifestyle change as far as the nutrition. I'm going to remove all the things that are pro-inflammatory and going to, you know, like, create inflammation in their body and make them sicker, things that the body, the immune system, just as a general rule, most people, their immune system doesn't react well to. But I'm also going to have them remove sugar, because sugar is a big pro-inflammatory, and it feeds a lot of the stuff that grows inside of our body, like yeast and some of the parasites too. So I mean, it goes without saying, eat organic as much as you can. Look at the Dirty Dozen, the Clean 15. If you can't eat 100% organic, that's a good thing to go to. No processed food. If it doesn't grow off of a tree or out of the ground, and it doesn't walk around and eat grass and pick at bugs, then you probably shouldn't eat it.
Right.
Now that being said, there are things like good clean yogurt that you do need to process a little bit to make it, fermented foods, kombucha, things like that. But for as a general rule, and I like, or I will eat organic, like tomatoes that are canned, but for the most part, if it doesn't look like, and it is not in the form that it was created, it's probably not something that you want to put in your mouth.
Right. 100%. And I'm trying to think of what I wanted to respond to with this or just generally
Sorry, I
talk.
just kind of like had this like,
No, it's okay.
this flow.
No, it's all good. I think it's very informative and there's a lot of key takeaways in there. And I know it's like helping people understand what parasites are, how they affect the body, recognizing symptoms, and to seek proper diagnosis with these specific tests you mentioned and how conventional tests kind of fail. I
All
always
the
like
time, fail all the time.
fail all the time. And there's really no false positive. If it shows up, it's there, you know.
Yeah.
I always like doing 3-day stool collection tests because you're going to have a better chance of
Yeah.
catching something. And I always like to tell people too, like, don't rely just on one stool test because your gut is like an ocean. And if you've ever gone deep sea fishing, and let's say you throw a big old net out there to reel in stuff, you might get little fish, you might get big fish, you might get the same fish, you might get no fish. And that's kind of what it's like when we're digging through our poop and
Yeah.
trying to analyze for bugs. So a 3-day stool collection and the GI effects from Genova does a 3-day. They offer a 3-day. Um, I think gives you more information of what can the person can be dealing with. And
Yeah.
working with so many people and having run so many stool tests, it's not about it's more about finding out what works for them in a harmonious way in an individualistic manner because we're all so different. And so, like I mentioned, the dog trainer person and my wife both had Hashimoto's, both have Lyme, both lived in mold, both had very different gut compositions. My wife had Giardia, this woman, blastocystis hominis, and some other things. And so we want to approach each one because we can use a combination of the herbs that you mentioned to help. And oftentimes people feel improvements in their energy levels, their fatigue diminishes, their mental clarity and their mental acuity and sharpness really is enhanced. Their sleep, oh my gosh, because you think parasites are often active at nighttime. And so if people have issues
And
with
during the full moon.
and during the full moon. Doing cleanses. My wife always does cleanses during the full moon.
Yeah.
Uh, but yeah, so at nighttime, if you find yourself waking up a lot, it could be that because you have an immune system response and these parasites are active at nighttime, they're nocturnal.
Yeah.
That could be a very good reason of why you're waking up and why you
Yeah.
have sleep.
And one of the other things sometimes too, it causes that restlessness in you at night, like the restless leg kind of thing that can happen because of parasites too. One of the things I wanted to mention with the pets. So when we think about, we give our pets deworming medicine stuff, like we do it monthly or we do it cyclically. Oftentimes I will just put someone on something every season, like we'll do like a parasite treatment 4 times a year with a change of every season. Or if I do herbs, I pulse them and I'll do like 10 days on, 5 days off, 10 days on, 5 days off. And I might have them do a couple cycles like that to cycle through, just because we have we have the growing, we have the dying, the growing, and Lyme, which is a bacteria and not really a parasite, but kind of works like that. It has different growth phases and it has different forms and shapes that it can take, and it moves around. And parasites are the same way. Like they take on different forms, they have different growth phases, they go to different places in the body. So if we cycle things through, like I cycle through a parasite rotation myself all the time. I'm all the time like on, especially like I travel a decent amount. And I always, when I come home, like I went to Australia and New Zealand for vacation last year, and I came home, and as soon as I came home, I put myself on a parasite rotation. And it was interesting too. I had also gone to Alaska last year, and I kept getting pneumonia, and I was like, I'm never sick. Why am I getting pneumonia? And I did a parasite rotation when I got home, and I ended up bringing lung flukes. It was a parasite that had encapsulated in my lung, and that's what kept making me sick. And I was like, well, that explains a lot. And so then I didn't have that issue again, because I had done the parasite rotation at the same time as, because I was actually able to see them, which was kind of interesting. But so cycling through on off through the, 10 days on, 5 days off, like I said, or just doing a rotation with each season, then whether we test or not, we're kind of staying ahead of the game then. There was one doctor I followed during the pandemic, and she was talking about this, how she often, this is what she does for herself. And so it was one of the, was already doing that myself. So I was glad to see that somebody of prominence was, having the same thinking, that, she just cycles through on off, especially like on the full moon. It really seems to make a big difference.
Huge. No, I think it really does. And I think for anybody, myself included and you, it's just beneficial to go through a yearly parasite cleanse, just
Mhm.
because of all the things that we do within a year, whether it's traveling, the
Mhm.
foods that we come into contact with, because occasionally we will go out and eat and you don't even know what the restaurant that you're eating from, where they
Yeah.
obtain their food and where their resources come from. So
I
it's
mean,
super
think about the
cool.
E. coli and the romaine lettuce, right? And think about the mad cow with the ground beef, just things like that. Like,
I
y-
was sick last week,
yeah.
on Friday and Thursday night. We went out and yeah, it's rare that that happens. And I was just like,
Yeah.
oh my.
Yeah.
And this is twice that this has happened at the same restaurant. One time it happened to my wife where, and we ate the same thing. That was what was so weird. This was last year or a year before that. We ate the same. Actually, we shared the dish. There was four tacos on this plate. So I had two on my side. She had two on her side. We ate and shared the same exact dish, but she ran home and she was fine beforehand. And then in the car ride, and this is a pretty upscale restaurant that we never have experiences like this. So, I mean, it's kind of sad that we've both been affected and
Yeah.
2 years apart. But you know, anyway, yeah,
And
it's just
and so
crazy.
to that when you both are sharing the same thing, one of you was, your body could handle it, and the other one of you, it just was like that moment your body couldn't handle it. So that happens sometimes too.
And it's weird because I'm like the guy who's the iron tank. Like you can
Usually, yeah.
cover me, and it's not it takes a lot to get me down. But for whatever
Yeah.
reason, when it's one of those 24-hour or 36-hour bugs, I'm so vulnerable to those. And anytime it runs a course through our family, I'm the one who gets it worse. And I'm the one that usually gets it last. I'm just like, oh man, because throwing up and vomiting, and especially when you can't hold anything down and you get that debilitating pain in your stomach that just wants to, you know, get everything out of you. And it hurts like, oh my gosh, it's just the worst thing ever. But yeah, there's a lot of things that we can do precautionary to really help ourselves. And
Yeah.
parasites is a really fun topic just because it's more awareness needs to be put out there. I used to work
Yeah.
for a company called Sailcore Biosciences, and so I've definitely seen my fair share of poop photos and people having some very strange things in their poop that don't look like normal stool from the Bristol stool chart. It doesn't look
Yeah.
like a somewhat melted Snickers bar if you
Right.
get graphic on there, but
Yeah.
yeah, it's amazing to see kind of what comes out of people and
Yeah.
to experience the breakthroughs they have in autoimmunity or just the improvement in their energy, their mental clarity. It's really cool. And, I think of kids too that suffer with skin conditions like babies born with eczema or kids that have a lot of asthma. I mean, there's other things that can be contributing factors to these conditions as well. But for the sake of just the parasite topic, um, a lot of these kids are probably just because of their diet and what they were passed on to from their mother in the womb, are born struggling. And
Yeah.
there's no wonder why we see an increase of childhood diseases today. But I wanted to touch on blood work because oftentimes most people have blood work that they can go back and refer to. There's a section called your complete blood count that'll have a breakdown of your white blood cells, and it'll have your neutrophils, eosinophils, basophils, monocytes, and lymphocytes on there.
Hmm.
And sometimes we can see an elevation in three of them, monocytes, eosinophils, and basophils. And it's not to say that when those three are all elevated that there's intestinal parasites, but when they are, I oftentimes do find a parasite, or I'll just treat for parasites. I'll just tell a person to take some natural herbals,
I
and they
just
often
did that this
don't.
week with a patient. We didn't, I always do a CBC, complete blood count with a differential. I can tell different things by the kinds of white blood cells that you were talking about. And we didn't do a stool test. We did that blood work in my scan, and I said, look, your eosinophil count, your basophil count are high. And it showed up on your other scan. I said, I think we should not even do a stool test. Let's just give you some parasite meds, because I think that that's what's going on. She's like, yeah,
Yeah,
okay. And I mean, that particular patient, she's been with me for a while. So she's like very accepting of, like parasites don't gross her out anymore, So,
for sure.
and I wanted to just throw in here, you mentioned about kids. One other way that we can get exposed, because this actually happened, I reminded me of my daughter. Um, I had, like I said, I have 5 kids. When we were little, when they were little, we would often go, we lived in town, so we didn't have any yard at all. We lived in a town when we had concrete. That was our yard. So we would often go to the park and play, and they don't have it anymore, but they used to have a sandbox. And one of my kids got pinworms because the neighborhood feral cats would go and do their business in the sandbox. And I didn't, because, they bury it. So you don't realize that is there, especially if it breaks down. And one of my kids ended up getting pinworms from playing in a sandbox at a public park. So,
Or
we don't,
ringworms.
pardon me?
Or ringworms.
Yes, or
That's
ringworm. Exactly the same thing. Another one of my kids got that from going to playing in the park. So we get exposed a lot more than what we think that we do. And being able to have the awareness and knowing what to do, how to recognize the symptoms, what's going on. And if you're not sure, seek out someone, like our clinic that, can help, is educated, knows what to do. Have been doing this for a long time. And because the traditional, like we've mentioned, traditional medicine is great in acute situations. They really thrive in like trauma, like car accidents, broken legs, things like that. But don't maybe do as good. We just aren't taught. Like I wasn't taught that in school. I was taught to do that little test that I told you about, and if we didn't see anything, and I was not taught how to read a complete blood count the way I read it now. Actually, I was taught completely differently. So, seek out help. There's things that we can do that, will be are very effective, including and especially with herbs that, that really help with and I have had a couple patients recently. They were new patients that we just followed up with, and just doing like, one cycle through their herbs, they're like, I can't believe how much better I feel, and I can't believe how much better I'm sleeping. And I just, I knew that this was going to work, but I didn't know that it was going to be as profound. So,
That's awesome. And
yeah.
I had a thought about the blood work when you were talking about you probably weren't, or how you weren't traditionally, how you were traditionally trained to read them. It's like, oh, you got high eosinophils or basophils, you got allergies. Let's send you off to the allergist and do the skin prick test to see what you're allergic to and get some shots scheduled
Yeah,
for
that's the only thing I was taught. I wasn't taught that it could be mold, it could be parasites,
you.
could be seasonal allergies, could be food,
Right,
and not just food allergies, like allergies as in like I eat peanuts and I get hives or my throat swells shut, like sensitivity, because that's one kind of antibody,
right.
IgE antibodies. This is food sensitivity. So I eat
Delayed
gluten
response.
and I get a headache and I get joint pain, or my ankles swell, you know.
I wanted to share one thing about because you were talking about how, when we go and deworm our animals, why don't we deworm ourselves?
Yeah.
There was another herb that just popped into my mind that's nicknamed a village pharmacy, and it's neem. And
Yes. Oh my gosh, and I love neem.
and neem is often something that we use to kill bugs on our garden plants.
On my garden, it works great,
Mhm.
especially on brassicas. It keeps those mealworms away.
Worms, keeps worms away. That's the key
Yeah.
there. It's
Yeah.
anti-parasitic to pinworms that you mentioned, roundworm,
Yes.
whipworms.
Yeah.
It's toxic to parasite and nervous systems, and it kills them.
Yep.
So neems are really
They just
good.
like curl up and die.
Mhm. And it even helps support the proliferation of good bacteria down in our gut. So it's
Yeah.
kind of a
Neem is
win-win
a
all around.
really, it's an amazing Ayurvedic herb. It's been used for 5,000 years or more.
It
In
helps
India.
bile flow. It's antioxidant. It has anti-cancer properties. There's a lot of information out there on neem, and
Yeah.
so it'll reduce inflammatory chemicals such as histamine, which can drive up those basophils or eosinophils as well from
Yep.
that allergic response.
Yep.
And these are sub-reactions that are being caused from a bigger problem behind the scene, right?
Yeah.
And you mentioned it too, like with food, why are we sensitive to certain foods? Is it this histamine reaction? And most people are like, oh, I got to take a Benadryl or something to
Sure.
help the
Yeah.
histamine. And well, how about we look a little deeper? Maybe there's an underlying issue such as parasites and
Yeah.
poor gut health due to the
Yeah.
parasites that can
Yeah.
really, if we focus there for a bit, do it 90 days and just see what happens and see if you feel better. Chances are you probably will.
Yeah. Yep. Good stuff.
Yeah, really awesome. I encourage listeners to seek, our help and other professional help, not just us, but those who are like us and like-minded if, they have any of these conditions that we mentioned today on the topic. And feel free to pause, take notes, go back and rewind, watch this again and again, share it with your friends and family. And that reminds me to ask you that if you get any type of benefit or find these podcasts valuable or informational, to please like and subscribe to our channel. It helps us get the awareness out there on these various topics that Teresa and I do talk about, discuss, and it helps the YouTube algorithms to push this information out to more people. And what we're trying to do is spread the message out there and allow people to become more educated so that they can become more defiant and vibrant in their health and
Yes.
see the right person that they can get help from. So thank y'all so much for listening. And yeah, again, leave a comment below and let us know what we're struggling with. And I would love to go back and read the comments and get to know you and who I'm speaking to and who's watching the videos. It's always fun to interact with the viewers. And so leave your comments. And
Yeah.
Teresa, thank you so much. I always appreciate discussing various topics with you. And it's so fun to hear your traditional training background and you being a now functional medicine provider and a nurse practitioner and how those two trainings can benefit one another when you combine them. And it's just a lot of fun. I really do appreciate these. So thank
Yeah.
you.
No, I love it too. I love taking, I call it an integrative approach because I pull from all the different things. I have functional medicine, I have naturopathic training, I have the traditional training. I just like pull, and I have training with, like the mind body connection. So I kind of bring it all together, and everybody has a very individualized approach, outcome. When we meet, it's about who's in front of me and how can I develop a plan of care that fits and suits the person sitting in front of me. So it's not just cookie cutter and it's not one size fits all. So, and I just love it. It takes me a little bit longer than it would, I spend a good bit of time and thought and energy into putting together the plans for folks because I do care about making sure that it's the right fit for that person. So, but
Amen.
it's my pleasure and I enjoy it.
Awesome. Well, be sure to follow us on our social media platforms. You can find us on Facebook, YouTube, Instagram, TikTok, Foundations and Wellness. We'll see you again next week. And Teresa, again, thank you so much.
All righty. Have a great weekend.
You too. Bye-bye.
Bye.